issue that affects millions of older persons: Alzheimer's disease and memory loss. Alzheimer's makes a tremendous difference in day-to-day living and changes the lives of individuals afflicted with it. However, it's comforting to have knowledge of the fact that there are methods and techniques which can possibly prevent or at least delay the onset of this debilitating disorder. In this article, we will examine the onset of Alzheimer's, how it progresses, and most significantly, how you can prevent mental impairment and have healthy brains as you age. Section 1. What is Alzheimer's disease? Alzheimer's accounts for 60–80% of dementia. Alzheimer's disease is a chronic, progressive neurological disease that attacks memory, thought, and behavior. Brain cells deteriorate and die, and mental functioning decreases progressively. The cause of Alzheimer's is not known, though it is believed to be genetic, lifestyle, and environmental. As the disease worsens, it decelerates day-to-day functioning, which is of concern to older individuals and their families. Section 2. Early symptoms and signs of Alzheimer's disease. Alzheimer's disease progresses gradually, and its symptoms differ among individuals. Classic symptoms signal the onset of mental impairment. Identification of these early symptoms allows early diagnosis and intervention. 1. Memory loss. One of the most noticeable early signs that can be observed is the inability to remember things learned recently. It is not uncommon for older individuals to forget important dates or events, and so they end up repeating the same bit of information over and over again on multiple occasions. 2. Confronting planning or problem-solving. Alzheimer's disease makes it very hard to do simple things, such as reading recipes or dealing with money. The affected individuals have trouble thinking about the present and take more time to accomplish things that they could previously do with ease. 3. Confusion of time or place. People with Alzheimer's may get confused with recalling dates, seasons, and time. They may not be able to recall where they are and how they got there, and will get lost and distressed. 4. Visual and spatial relations problems. Vision problems can significantly impair distance perception and facial recognition. Others also struggle to read or see color contrasts. 5. Challenges in writing or speaking. Alzheimer's may affect language, and difficulty in finding words is typical. Individuals may pause during the middle of sentences or repeat words due to forgetfulness. 6. The act of losing items and also losing the ability to adequately backtrack what has been done. People tend to put things in arbitrary locations, and consequently, they forget where they have placed them. It can be frustrating, especially if everyday items get misplaced. 7. Impaired judgment and decision-making. Alzheimer's disease severely compromises decision-making, causing bad judgment in finances, healthcare, and everyday life. Section 3. Analysis of the development of Alzheimer's disease. Alzheimer's disease typically advances in 3 phases: early, middle, and early stage. Mild. At the early stage, patients can still live on their own, but present some forgetfulness and might have difficulty with complicated tasks. They are able to manage their own personal affairs independently, but they need help with activity planning and scheduling calendars. 2. Middle stage. Moderate. In the middle phase of the condition, memory loss is more apparent. Individuals may need help with daily tasks like bathing, dressing, and eating. Additionally, changes in behavior may also manifest, including heightened anxiety, depression, and aggression. 3. Late stage. Severe. Patients cannot speak during the final stage of Alzheimer's and entirely depend on carers for daily activities. Patients may forget their own family members and require full-time care. Section 4. Prevention strategies for cognitive decline and Alzheimer's disease. Although it is true that Alzheimer's disease cannot always be prevented fully, there are some key lifestyle changes and healthy habits that individuals can adopt which can protect the brain and ultimately reduce the risk of developing cognitive impairment. Here, we will talk about some of the most probable ways that can be adopted to maintain optimum brain health as one ages. 1. Remain active. Regular exercise is widely regarded as a healthy way to prevent mental decline and remain mentally sharp with age. Exercise enhances blood flow to the brain, supplying necessary nutrients and oxygen, and also provoking the creation of new brain cells for brain health. Aim for 30 minutes of moderate exercise on most days for mental benefits. Older people walking, cycling, or doing yoga outside. 2. Engage in mind-stimulating activitious mental stimulation is essential to brain function and mental health. Puzzles, reading, learning a new language, or pursuing hobbies are all ways to keep the brain stimulated. This has the effect of slowing down memory loss and enhancing mental sharpness as one ages. Footage ideas. Seniors reading, playing chess, or crosswords. 3. Consume a brain-healthy diet. A good diet is necessary for healthy brain functioning. A person should consume plenty of nutrient-dense foods like fruits, vegetables, whole grains, lean proteins, and healthy fats like omega-3s. Salmon, leafy greens, and lean nuts are foods that enhance brain health and function. Stock footage concept. Preparing or eating a healthy meal with vegetables, fruits, and fish. 4. Make sure you get plenty of sleep. Sleep plays an integral part in brain function and healthy living. There is evidence that having a poor sleep quality or even shorter sleep has been shown to increase individuals' risk of memory loss and even disease like Alzheimer's. It's essential to have 7 to 9 hours of sound sleep every night and establish a relaxing bedtime routine for a good sleep. Stock footage idea. Seniors in bed, fading lights, or employing a sleep aid such as pillow spray. 5. Minimize and manage stress. Chronic stress is detrimental to the brain. Effective stress management techniques like meditation, deep breathing, and mindfulness are crucial. Their regular practice can largely prevent long-term cognitive impairment. Include stock photos of older people meditating or doing breathing exercises in a peaceful setting. 6. Be socially active. Social relationships are major contributors to maintenance and improvement of brain health. Being engaged in regular social engagements, such as merely enjoying life with family and friends, or taking an active part in a social organization, does a lot in preventing the state of isolation one is bound to experience. Apart from that, social interactions have been noted to enhance cognitive ability, which proves useful to the general mental condition. Concept. Elderly individuals socializing with others of their age group and participating in group activities. 7. Quit smoking and excessive drinking. Smoking and heavy drinking increase the risk of mental decline and Alzheimer's. Quitting smoking and reducing alcohol can prevent brain damage. Stock footage concept. Seniors adopting healthy habits like quitting smoking or abstaining from alcohol. 8. Effectively manage chronic diseases. It is important to manage chronic diseases like diabetes, high blood pressure, and cholesterol for cognitive health. Follow your doctor's advice on medication, diet, and exercise to manage these diseases. Elders who are exercising, taking medication, or checking blood pressure. 9. Health exams and assessments. Regular checkups with the physician detect and track risk factors for mental deterioration. Early detection and treatment are crucial to effectively halt Alzheimer's progression and improve health outcomes. Elders going to a doctor for a checkup. Section 5. What to do if you are showing signs of Alzheimer's disease. If you or someone close to you is showing signs of Alzheimer's or mental deterioration, see a doctor as quickly as possible. An early diagnosis can manage symptoms and guide future planning. 1. Consult a doctor. Your symptoms will be assessed by a healthcare provider. You will undergo tests, and you will be referred to a specialist for evaluation. Being diagnosed early is important so you can have a proper treatment regimen and receive necessary support services in your recovery. 2. Care and assistance provision. If you are providing care to a person with Alzheimer's, obtain support. Connect with others who share your experiences through a caregiving support group. Place the person with Alzheimer's in a structured, caring environment. Summarize in short, Alzheimer's disease is a challenging condition for patients, caregivers, and families. However, preventative measures exist to protect brain health and reduce future risk of cognitive impairment. Regular physical activity and mental stimulation are crucial. A well-balanced, nutrient-rich diet, stress reduction by relaxation, and early medical consultation are significant approaches in the management and treatment of Alzheimer's disease. Thanks for viewing today's video. If you liked it, please like, subscribe, and share it with other individuals who can benefit from it. Let us watch each other's backs as we age, and keep in good health and mental sharpness. See you in the next videos. Take care.